Also, I am a mother of 3 daughters. Let me allow my presentation. The effectiveness of a fixed combination of perindopril, arginine, and indapamide on the daily indicators of central hemodynamics and arterial stiffness in comorbid patients with arterial hypertension and metabolic syndrome. According to the latest epidemiological study of SCRF, the prevalence of hypertension was increased from 40 to 44% over the past 6 years. By 2025, the number of people suffering from elevated blood pressure is projected to increase to 1.5 billion. With age, the number of men and women suffering from arterial hypertension increases. Pulse wave velocity more than 10 millimeters per second is approved as a marker of vascular wall damage and an independent cardiovascular risk factor. It is known what pulse wave velocity is subject to daily fluctuations, and therefore it is of interest to study its diurnal dynamics. Prognostic value of central aortic pressure and is closely associated with arterial stiffness, still being discussed and requires further research. It is known that in young healthy individuals, the difference between brachial and central blood pressure can be more than 30 millimeters per m due to pulse pressure amplification. With age increases, the stiffness of the central arteries and central blood pressure becomes higher than at the periphery due to the reflected wave. Thus, the central aortic pressure and its deforming load on the heart more realistically reflects the load on the left ventricle. Currently, the study of comorbid conditions is of increasing interest since most patients have several diseases of different organs and systems, often aggravating each other. Comorbidity is the coexistence of 2 and or more diseases in one patient, pathogenetically and genetically interrelated. The most frequent combination of comorbid condition is associated with cardiovascular pathology, including hypertension. Of great interest is the combination of arterial hypertension with overweight and the development of metabolic syndrome. It is proved that cardiometabolic disorders led to early and significant lesions of target organs. On these indicators in patients with hypertension and comorbid pathology. It is assumed that the association of arterial hypertension with metabolic syndrome exacerbates the structural and functional changes in the cardiovascular system, worsens the arterial hypertension, especially parameters of central aortic pressure and arterial stiffness that affects the cardiovascular prognosis. Also, the aim of our study is to study the effect of 16-week therapy with a fixed combination of perindopril and arginine on central aortic pressure and arterial stiffness. The study included 65 patients with hypertension, which amounted to 2 main groups. First group, 33 patients with arterial hypertension, and second group, 32 patients with arterial hypertension and metabolic syndrome. Control group consisted of healthy persons, or 30 people matched for age and sex. The patients were performed routine research methods, urinalysis, general analysis of blood, biochemical analysis of blood, electrocardiogram. With measurement of daily monitoring of the central aortic pressure and arterial stiffness was performed using the oscillometric device PiPiLab was attends with the analysis of the main parameters, central aortic pressures and arterial stiffness. You can see at the slide. In our study, we include men and women aged from 30 to 65 years, the presence of hypertension, the presence of metabolic syndrome, the right and consent for participation in the study, the ability to follow the study protocol. We exclude pregnant and lactation women, mental illness, the presence of acute disease and time of inspection, participation in other clinical studies at the time of recruitment or a similar clinical study within the previous 3 months, the lack of informed consent, the inability to follow the study protocol. We exclude also symptomatic arterial hypertension patients and the patients with presence of association clinical conditions such as coronary heart disease, cerebrovascular disease, peripheral artery disease, hypertensive retinopathy, severe disorders of rhythm and conductivity, non-coronary myocardial diseases, and diabetes mellitus. In this slide, we see that body mass index, waist circumference, cholesterol, low density lipoproteins, and triglycerides were statistically significantly higher in the group of arterial hypertension with metabolic syndrome compared to the group of arterial hypertension and control group. The study groups were comparable in the degree and duration of hypertension. In the study groups, the daily profiles on non-depots prevailed with the absence of a proper decrease in blood pressure at night. Daily monitoring of central blood pressure parameters by oscillometric method allowed to detect a significantly high level of systolic blood pressure in the aorta, diastolic blood pressure in the aorta in all study groups of examined patients compared to control group. Significant differences in the parameters of pulse pressure in aorta during the day. These groups are not mentioned, but the pulse pressure in aorta was high in group of arterial hypertension and arterial hypertension with metabolic syndrome compared with control group. In the group of arterial hypertension and metabolic syndrome, significantly lower rates of pulse wave amplifications were revealed compared to control group. Intergroup differences were also revealed between the arterial hypertension metabolic syndrome and arterial hypertension groups in the average daily and nighttime parameters of pulse wave amplification. In all the study groups revealed significantly high levels of pulse wave velocity compared with control group. Pulse wave velocity is significantly high in the group of arterial hypertension with metabolic syndrome compared with arterial hypertension and the group of control group. Arterial stiffness index was statistically significantly worse in the group of arterial hypertension with metabolic syndrome and arterial hypertension group compared to control group. In group of arterial hypertension with metabolic syndrome, arterial stiffness index was statistically high compared with arterial hypertension group at night. The PTIN index is a percentage expression of the time of day during which the pulse wave velocity value didn't exceed the threshold of the accepted norm 10 millimeters per second. In groups of arterial hypertension and arterial hypertension with metabolic syndrome, this index was lowly compared to control group. In group of arterial hypertension with metabolic syndrome, index PTIN was lowly, statistically lowly compared with group of arterial hypertension. Thus, we see that in the groups of arterial hypertension and arterial hypertension with metabolic syndrome, the indicators of central aortic pressure are statistically significantly higher. In the group of comorbid patients, arterial rigidity indicators are worse, especially at night. Taking into account these changes, we conducted a study on the effect of a fixed combination of perindopril, arginine, and indapamide on the daily values of central aortic pressure and arterial stiffness in comorbid patients with arterial hypertension and metabolic syndrome. All the subjects didn't take any antihypertensive drugs for 4 weeks. All subjects were given recommendation on lifestyle modification. The parameters of peripheral and central aortic pressure, arterial stiffness were measured before the start of therapy with a fixed combination of perindopril, arginine, and indapamide, and before 16 weeks after therapy. After 4 weeks of therapy, if necessary, a dose adjustment was performed. We use 3 dosages of this with free doses, depending on the blood pressure level. After treatment of 16-week therapy with a fixed combination of perindopril, arginine, and indapamide, there was a statistically significant decrease systolic blood pressure, diastolic blood pressure, pulse pressure, peripheral, and in aorta systolic blood pressure, diastolic blood pressure, and pulse pressure. Similar changes are observed in the daytime. Also, after treatment, nighttime indicators of peripheral and central aortic pressure also decrease. Now we saw that decrease index augmentation at night. After treatment, there is a decrease in the variability of systolic blood pressure in the daytime and at night. The rate of morning rise systolic blood pressure and diastolic blood pressure. We will also see a low level of hypertension, which indicates the safety of the drug. After treatment, all indicators of arterial stiffness decreased, such as pulse wave velocity, arterial stiffness index, reflected to weight time increase, increase index 15, and also decrease a vascular aid. Vascular aid we calculated using a score scale modified by the Agostina. So after treatment, we noticed statistically significant improvement in arterial stiffness was noted. The pulse wave velocity in the aorta decreased by an average of 0.7 millimeters per second per day. The rigidity index decreased by 17 millimeters per day. Vascular age decreased by an average of 7 years. And the reflected wave time increase. So, conclusion, daily indicators of central aortic pressure and arterial stiffness revealed the greatest pathological changes, especially at night, in the groups of arterial hypertension and metabolic syndrome. These indicators are deterioration in the elastic properties of the arteries. In patients with arterial hypertension and metabolic syndrome, after treatment of 16-week therapy with a fixed combination of perindopril, arginine, and indapamide, statistically significant decrease in daily indicators of peripheral, arterial, and central aortic pressure. Systolic blood pressure decreased by 24.7 millimeters on average during the day, diastolic blood pressure by 8 millimeters, pulse pressure by 7, systolic blood pressure in aorta by 13.7, diastolic blood pressure by 8.5, and pulse pressure in aorta by 5.3 millimeters. Decrease in the variability of systolic blood pressure and diastolic blood pressure in the daytime and at night, and the speed of morning ascent, systolic blood pressure and diastolic blood pressure. Statistically significant improvement in arterial stiffness was noted. The pulse wave velocity in the aorta decreased by an average of 0.7 millimeters per second per day. The rigidity index decreased by 17 millimeters. Vascular age decreased by an average of 7 years, and the time of reflected waves. Thank you for your attention. I'm ready to answer your questions, or you can write me by mail. I will leave it in the chat. Any questions?